What are some of the things that you should worry about after having surgery? Well, certainly infection is a big one. So if you start to feel like you have a fever, you feel achy all over like the flu, you have a fever, you feel tired, you feel fatigued, you could be developing an infection. Wound infections generally don't occur in the immediate postoperative period, although it is possible. Generally, fever in the first 24 hours is going to be coming from the lungs. Beyond that, it can come from a number of things. It can come from blood clots, it can come from a bladder infection, it can come from just the fact that you're laying in bed. If you're going to get a wound infection, you'll generally note that the wound is becoming red. If your wound becomes red beyond the margin of just where your staples or your sutures are, then you may be developing a wound infection. If you're seeing green pus or discharge coming from your wound, say 7 to 10 days after surgery, this is obviously very worrisome, and you should contact my office or go to the ER immediately. What some people will experience, however, is something called a seroma. When you have back surgery, there's a collection of fluid called a hematoma, or blood, that collects pretty much no matter what we do. This is just normal due to the size of the incision and the tissues that we are cutting through. This hematoma will go through phases. It starts off as blood. The blood then thickens and becomes a hematoma, kind of like jello, turns into jello. The jello then will turn back into a liquid, and that will form what's called a seroma. It's actually best for this fluid to come out of your body. Some people panic when they see a clear, straw-colored fluid come out of their back just a few days after surgery. This is nothing typically to worry about. If it happens, we do want you to contact the office and let us know, and certainly allow us to answer any questions that you might have. But this will often happen in the absence of a fever. You won't feel achy all over. You won't feel sick. And this is nothing to worry about. Again, this is your body's way of spitting out that unwanted fluid. We really don't want that fluid to stay in there, as it becomes a culture dish potentially for bacteria. But a seroma exiting from your back it may soak your bandages for a few days. It should stop, and you should see a trend of the discharge getting less and less each day. If, however, you're seeing green pus, you're having fever, you're feeling achy, or the discharge is increasing, or you see bright red blood coming from your wound, these are worrisome, and these are things that you should let us know immediately so that we can help you deal with them.